some reasons that we think that that's the case. We are a mixed county with a lot of urban areas, but still a lot of rural areas. So we have some disparities there built in because of the geographic nature of our counties. We're just not as urban as Sacramento, and some people in our county have a more difficult time accessing health care or even getting to health care in a timely manner. So we do know that a lot of our constituents sometimes wait until they're a little bit sicker before they actually present to healthcare, and that's unfortunate because by then they've been out and about in the community transmitting and spreading COVID. In addition to that, we're just really agriculturally a busier county. We have a lot of farming here, and so does the entire Central Valley. So if you look up and down the Central Valley, it's one of the reasons why we think we're more hard hit. We have a lot of migrant farm workers moving around, and these people are essential to the economy and essential to food production for the entire nation. But we do know that they carpool to work and they live in housing units together in very close quarters and large groups. So that's one contributing factor. It's not contributing to the entire case count, but ag in the Central Valley is one of the things that makes us different from Sacramento. In the last few weeks, we've seen a significant rise in our Hispanic population, whereas before it was pretty evenly spread across ethnicities. We're now seeing that 60% of our cases, 60 to 70% of new cases are within the Hispanic community. So we're really trying to analyze the data and figure out where that's coming from and to target that population. But part of it is tied into the farm worker industry, and there many of these people have been essential workers since the beginning and have not stopped working through this entire crisis. We're trying to figure out what we can do and how do we get to this population with appropriate messaging that's going to be socially and culturally appropriate. We're trying to reach them in places where they're going to be more apt to listen, Spanish radio, Spanish TV. And we've done some studies analyzing the behavior of the Latino population. What we're finding is very interesting. They're a very loving community. And I think sometimes when we interview them, we find that they don't think it's proper to have a mask on when you're about to greet a loved one or a family member. And it's not to put labels on people, because a lot of them are actually really following the rules of social distancing, and they're really masking and washing their hands. But and what we're finding is that on top of that, they have not stopped doing the gatherings. And I think maybe we need to talk to this population more about how, even if you are distancing yourself in the supermarket and distancing yourself in public, you're also supposed to distance yourself from people you don't live with. And that's a hard message to deliver when so many people are wanting to see their relatives and friends in household gatherings. Well, there's a lot of questions on my mind, and I wish I could predict the future, but what I'm going to be wondering about is how are we going to be doing in a few weeks? The governor has just asked us to shut down some more sectors and wait for 3 weeks and see how it pans out. And so that's the biggest question on my mind is the public going to listen? And I'm really pleading that the public listens. You all kind of know what's open and what's not supposed to be open, and please follow the rules and stay home as much as you can. And if you want to go out for essential needs, make sure you're going out to a business that is actually allowed to be open. Because that's what my question is how many people are going to really try to get our numbers back down, and what are our numbers going to look like in a few weeks? I don't know. It's my biggest concern, because around that same time, we're going to start getting some flu, and we're going to start getting kids going back to school, and a lot of it's going to be happening at once. And that is what's weighing on my mind right now the most.